IM Intramuscular Injection Syringe Cefatriaxon 500 mg and Dexamethasone Ventrogluteal Injection by Nurse Sarah. It was a busy morning in the outpatient treatment room when Nurse Sarah received a physician's order for an intramuscular injection of cefatriaxone 500 mg with dexamethasone for a patient suffering from a bacterial infection and inflammation. Before preparing the medication, Sarah carefully reviewed the doctor's prescription and confirmed the patient's identity using two identifiers. She asked the patient about allergies, especially to cephalosporin antibiotics, and explained the purpose of the injection. The patient understood the procedure but admitted feeling nervous because previous injections had been painful. Sarah reassured the patient with a calm smile. "Some discomfort is normal," she said, "but I'll use the proper technique to make it as comfortable as possible." She performed hand hygiene, put on clean gloves, and gathered the required equipment. Sterile syringe, appropriate IM needle, alcohol swabs, gauze, and a sharps disposal container. She inspected both medication vials, verified the expiration dates, and prepared the medication according to her hospital's protocol. Because the medication volume and the patient's muscle mass were appropriate, Sarah selected the ventrogluteal muscle, one of the preferred intramuscular injection sites in adults due to its distance from major nerves and blood vessels. She helped the patient lie comfortably on one side with the upper knee slightly bent to relax the hip muscles. Using anatomical landmarks, Sarah carefully identified the correct ventrogluteal site. She cleaned the skin with an alcohol swab and allowed it to dry completely before proceeding. "Take a slow, deep breath," Sarah encouraged. As the patient exhaled, Sarah inserted the needle smoothly at a 90-degree angle using a quick, controlled motion. The patient felt the brief sting of the needle and tightened the muscles for a moment. Sarah reminded the patient to relax and continued administering the medication slowly, following her facility's protocol. Because cefatriaxone can sometimes cause discomfort during intramuscular administration, the patient experienced a burning sensation and mild pain. "Ouch, it burns a little," the patient said. Sarah acknowledged the discomfort. "That's understandable. Try taking slow breaths. I'm almost finished." She maintained a steady pace while observing the patient for any signs of dizziness, allergic reaction, or unusual discomfort. Within a short time, the medication had been completely administered. Sarah withdrew the needle smoothly, applied gentle pressure with sterile gauze, and immediately disposed of the needle in the sharps container without recapping it. She assessed the injection site for bleeding and asked the patient how they were feeling. "The pain is already getting better," the patient replied after a few moments. Sarah instructed the patient to report any persist.